Hello, Dr. Hashmi here. I'm just a psychiatrist. This is my third video on ADHD throughout life. This video is on two specific phenomena which you see in children with ADHD. You also see these phenomena in autism, dyslexia, and some mild learning difficulties. But let's talk about attention deficit hyperactivity disorder. The first phenomena is auditory processing delay. What you see in real life is child not listening to you or doing something entirely different what is being said or asked a child to do. It is not because the child doesn't want to follow your command as an adult. The child is just not being able to comprehend and understand the information given to him. There is a processing delay or disorder. It is not the physical disorder of hearing. It is elements of physical very fine. So if you send a child for audiology, that will be perfectly fine. You will not see any disorder in the perception of the information in the sense of audiology assessment. But what you see is the understanding of the information. So I'll give you three words which commonly make the child to get confused. Blue, ball, and bell. Now you might use the word blue, the child might understand bell or ball, and vice versa. It's a very, very simple example. Now, if you see that your child is not listening to you or doing something which is not asked him to do, but similar to what is being asked to do, suspect auditory processing delay or disorder. The assessments are carried out by speech and language therapist, but in Britain you go to the GP for this disorder, and obviously all the referrals start from GPs. Having said that, if you have access, speech and language therapists carry out this assessment. They are very comprehensive and they can actually identify where the problem is. The good news is this condition is totally recoverable. You just need to follow certain rules when holding conversation with a child, and the perception of information improve. The child will start understanding exactly what's being said to him or her and will act on it. When you undergo an assessment by a speech and language therapist, they will tell you the way you need to hold conversation with the child. Very clear, short sentences, repeat if necessary, and there got to be no ambiguity in your conversation. Got to be direct conversation to the child in a brief sentence with a very clear pronunciation of words. This is the technique. And then ask the child to repeat or tell you what's being said and what is asked to do. Simple technique. If you follow this, the child, you will see, will recover from auditory processing delay or disorder. But it will take time. Might be 6 months, a year. So be patient. Speak to the child. One action in one conversation. So brief, short sentences with clear pronunciation, carrying one command. and then encourage child to explain to you what's being said. Now, once this stage is achieved, the second stage is read simple stories with the child. Encourage the child to read the story. Simple stories, plenty of books out there. And once you have read the story, ask the child what he has understood out of that story. And then if there is a specific character in the story, ask the child that what Tom did with his balloon. What if the blue balloon ended? Where did Tom get the balloon? Things like that. So that it invokes the thought process, the connections, and will give you an understanding how the child has understood the story. Pick simple questions from that story. What the cow did after finished eating grass. Simple story. With simple questions, just pick it, make it up, and ask the child. This is the second stage. Now the second video I'm going to do is on information overload. I hope you find this video useful. Thank you very much. The earliest sign of our memory problems is difficulty in retaining new information, learning new information.